Well, greetings again. This is Dr. Bill Wyatt again with the American Orthodontic Society, and that's where you need to go if you want to just starting out. They've got courses and teach you. And we're in beautiful Grapevine, Texas, where I used to live and used to teach there on the lake bank. So hope that anybody wanting to start out studying orthodontics, any dentist, you can go there and study orthodontics. And thank you for watching. And I'm going to show a double jaw surgery. It's a class 3 case that we did the double jaw surgery. And we've kind of got it where we can take out the 6-year molars on some of these cases. And by pulling the molar teeth forward here, we actually pull upper teeth forward, and we, with class 3 elastics hooked up on the molars up here and the lower anterior, we bring them back and pull the upper forward and get a double jaw treatment without the double jaw surgery. So that's one big help for it. Let's get going on this case now. We've got a lot of slides, and I want to try to go through them fast, and you can go through them slow as you want to. Here's a young lady, a very nice looking young lady, and you can just look at her from the front and tell the chin is protruding out here more than it should. And so you look at it from the side, it looks like she just got a very prominent chin like that. That's not too bad. If it was on a man, that might look good. But on a young lady, that's an aggressive look that you probably wouldn't want to have. And then you look at the teeth, and the second molar, the first molar is way up here, you see, and the second molar is back here. So the jaw is up in front, probably a good 1/4 of an inch here. We need to bring it back in here. And then sometimes the tongue pushes out here, and so instead of shortening this and squeezing the tongue, and they tend to relapse, they come in and take the upper jaw loose and move it forward, and that gives the tongue more room in here, and so that works pretty good. I know some oral surgeons that hardly will do a single jaw surgery simply because the chance of relapsing is very, very bad. And they've got to come in with some special retention, which we have developed for them. Now, okay, let's watch this case go through. On the other side, you see the same thing. The first molar out here, the second molar back here. Here's the second molar. And the first molar and the second molar up above. All right, same thing. You don't see much liquid on that deal, and down on below you don't notice this tooth broke off the model. And here we band this case up. We've got these clear brackets up here, and we put these real low down on the bottom, and that kind of hides the brackets a little bit. And so that helps in the getting it ready for the surgery. And now you'll work with a surgeon on the cases like this, and we've got little hooks where we can pull these together and hook them up on that. And the surgeon will tell you what he wants you to do, actually. And it doesn't matter. I'm a general dentist, and I've done much orthodontics. I've worked with lots of oral surgeons, and they know I can do the orthodontics, so they didn't care at all that I was a general dentist. I've done a lot of oral surgery with them, and they knew I could do the orthodontic part of this. And so here we've come in, and we're wearing some class 2 elastics here. Apparently coming up here, a lot of times they'll do that and pull this up a little further, and you can't see it very much, but there'll be a scar up in here where we sectioned the maxilla loose and brought it out some, And let's go through this. I won't have time to go through all the surgical procedure on this, but you work with the oral surgeon to do this, and you don't have to go down anything. Now you can see the suture line up in here. Now on the lower jaw, they may have left it out, just let the lower jaw stay and bring the upper jaw forward, but they sometimes will take this off and bring it back. I think we'll show you on your x-rays where the lower jaw has been worked on also. We'll get there in a minute. Now here is the finished product. You can see what an ideal profile we have here for this young lady, and looks very good. Here's another view at it. A little bit of a prominence there, not too much. And this is she's still in the braces. And here we go. This is 1991 now. And we're coming up on the finishing up of the case. And there it was when we started, and there it was after the surgery and after we completed. I'm going to get to the x-rays here in a little bit. And there's the way the class 3 was with the lower jaw out in front now, and kind of a closed bite. And here it is where we treated it. Okay, this is 91, 10 of 91, and that was 88. It was like that. Now that's 91, and that's lined up good. Okay. My voice is kind of rattling today, but here's what the oral surgeons, we sent a cephalometric x-ray, of course, with this, and she's age, I believe, 16 at this point, so she's not going to grow anymore like that. And you have a drawing, or the oral surgeons will do his own cephalometrics a lot of times, and we know just where this is coming. And here it is after that. That x-ray was in 1988, 8/11 of 88, and this one here is, she's age 17, it's 10/15 of 91. So this is few years later. And you see where the upper jaw is tied in right here, and you see the screws in the lower jaw where it was brought back, and they screwed it together back in this area. And there are the wires wiring this in with some little deals there that apparently hold something in place. Same thing here now. Okay, this will give you another viewpoint where the screws are holding the jaw in place right here. And these are little wires that are wired up in this portion of the upper jaw, keeping it in place. And this is the case after. And there's the smile after we finished. And the teeth are lined up there in 1993. So there it is in 88, and this is 93 on the right side up here. 83 and 93, 88 and 93. And this is the upper jaw, and the lower jaw, you can see what was done. Okay, I thank you for watching, and sometimes you can do these cases by removing the 6-year molars and pulling these lower teeth back. If you go back, you pull the upper teeth forward with that and get a slightly semi case where you pull the upper jaw forward slightly and pull the lower anterior teeth back and then close and pin them down, and then bring the back teeth up to that. So that's the way we do class 3s, where you just work both jaws, and you do have no surgery in here. So it's a lot cheaper and a lot better, really. If you watch somebody take the maxilla loose, you'll be glad to do that. So thank you for watching, and I want to sign off, and we'll hope you'll get something out of this, and I'm going to close out now. Thank you for watching. I hope you'll join our group and subscribe, and come out if you're wanting to learn orthodontics. Go to the American Orthodontic Society in Grapevine, Texas.